honored to have a chance to be here and represent our family. I have my sister Sherry, who's here with us, my niece Sydney, and my other niece Andrea. So they are all here. I asked them if they wanted to speak, and they said, I guess that's up to you. So, okay. But that doesn't diminish the commitment and the heart and the work that we do together as a family and the engagement that we have together to stay close to this organization and to really live out a lot of the vision that Tina was talking about. And it is so fun to have a chance to be here with Pine Rest and with Mary Freebed, and to have a chance together to connect so many great institutions. That is really fun. But as Tina talked about earlier, you know, my mom and dad had a great vision, and we miss them. It's been 7 years almost since mom passed, 6 for dad, and they leave a hole. But we're not the only family that's experienced that. Every family, when you lose someone, it leaves a hole, and you miss them terribly. But what you remember about them is their dreams, their passions, and the things that were important to them. And it's an honor to be able to continue on in some of those traditions. And one of them certainly was here at the Children's Hospital. And Tina referenced years ago, Mom and Dad had a chance to sit down and kind of write out a few things that were important to them and their vision about the Children's Hospital. And it's fun as I look back on that document, I can kind of see how this happens, because it was written down, and the first thing I know is that Dad didn't write it because it was typed as well, and I know Mom did that. And so the cool thing about it, beyond the words, is you can see the two of them talking, dreaming together, thinking about what could happen here and the importance that it had for them in their lives. The focus on patients, on children, and that their faith drove them to be involved in so many ways in our community, and that it was part of everything that they did, and they wanted to stay focused on those kids, that they wanted to understand that kids needed care here, and if they had a complication or a special case, that we needed to develop the capabilities here by studying different areas so that we could keep families together, that we didn't have to create distance to get the care that was needed. So a lot of work went down in these different areas of expertise. And then we wanted to empower the teams that are working closely with all the patients, the nurses, the doctors, all the teams that are creating the right environment for a patient and for a family when they're going through a tough time. And then, of course, the connections with other institutions of higher learning, whether it's the Banana Institute, Michigan State, or others that we work with. And so it's an honor to be able to reflect that. And in those words, as they wrote, you can see that they took the inspiration from the kids, from the families, from the nurses, from the doctors. They took inspiration from the volunteers and everyone who makes a place like a hospital work and puts their heart and soul, their talents and skills into the care that's needed to be given to a patient or a family that's hurting. You can see that inspiration happening. And so we want to continue in the tradition of stewardship that we see demonstrated in this community. So many in this community have stepped forward with their time, with their talent, with their treasure to volunteer and offer to be engaged, and we're happy to continue, and we're honored to be able to continue in that tradition here. And we love to see the collaboration that's happening, that this community doesn't compete, this community collaborates, and we figure out how to work together. What can we do together to be better? To be better, because that's what's demanded from our community. How do we improve? How do we provide better care for more people in better ways? And you see people every day in these institutions working and thinking and committing themselves to make that happen. And while we spend a lot of time thinking about facilities, and you look at beautiful facilities that are built, we always know it's the people. It's the people inside the facilities. These facilities are necessary. You need a great environment. You need the things that are provided, the tools to provide the support for all the teams and the medical professionals that are providing such great care. And you need the right environment for a patient that's working through a challenge. And so, while there's facilities, we always make sure we look through the facilities and see the faces of the people that do such great things. And we're excited about the future. We're excited about what this sort of collaboration can bring and the step that we can take as a community. And we're honored to be able to be part of it, to be able to see what we can do to help more people in an even better way. And so this is a joy for us, for our family, as we've had the time to work with all these institutions and to think through and to say, how can we be helpful? And again, it's that stewardship tradition in this community that's shared by all of you that are here and so many others in our community that stay connected, that volunteer, whether it's through the medical community or through other things that are important, that makes all of us better here in West Michigan. And that's what we want to continue to do. And so that's what we believe that this gift reflects. We believe that the gifts of so many donors in so many ways and the volunteer hours that are given make our community better. And so we're honored to be part of that stewardship tradition and to continue to move forward. And so with that, on behalf of my sister and my two nieces and really all of our family, we're representing a lot of others that are here. And when you think about children, we've done relatively well at continuing that tradition. So we're going to keep that one going as best we can as well. And our community will continue to grow. And as we hear the beautiful voices of our choir, thank you so much for what you did to get us started in the right frame of mind to think about love. So thank you, and we appreciate your stepping up. Not an easy thing to do in the morning, is it? Singing is hard enough. A few of you with the solos, too, had to get out there and make it happen. But again, another wonderful reflection of how people come together and commit to our community to add beauty, to add heart, and to add love. So thank you for your time sharing with us as well. And with